Hi, everyone. I'm Dr. Aylah Clark, and tonight I'm going to be talking about chronic inflammation. Um, so, to start, we're going to kind of go through just some of the basics of what inflammation is and some of the conditions that it can most affect, though we'll find it's many. And then I'll talk a little bit about just how we measure inflammation, the different ways we might be able to get signs of it. And lastly, we'll go through some of the many ways that we can reduce inflammation. All right, so get started here. So, inflammation is it's primarily a response from your body that is intended to protect you from infection or injury, as the two prime examples. Classically, that involves heat, pain, redness, and swelling. Um, you'll see the Latin words in medical textbooks, calor, dolor, rubor, and tumor commonly, which mean those words I just listed. And that's certainly an oversimplification of what we actually are experiencing with inflammation. It's really quite a complex cascade of responses in our body involving different immune cells and inflammatory mediators. And it's also a complex interaction with our environment, our genetics, and even our microbiome. Here's an image that just shows a few of the main participants in inflammation, some of the immune cells that are involved, like mast cells that are involved in that histamine response, macrophages, fibroblasts, and all kinds of other good stuff. And those cells release all these other inflammatory cytokines. As you can see here, these in bold, you see different cells that you may be more familiar with since these past couple of years, B cells and T cells, neutrophils. Um, these are all releasing all these different inflammatory cytokines. Don't worry, we won't go into much more detail on that stuff. But one thing that's important to know about is really when does it become harmful? Because we certainly do want our immune system mounting these responses in response to an injury or an infection or even to exercise in the short term. But if it's long-term inflammation, not controlled, and if it's not really there for a good reason, like in autoimmune disease, your body's attacking itself. Allergies, you are hyperreactive to certain things that are not truly a threat. And then lifestyle stuff like an inflammatory diet can contribute to harmful inflammation. So here are some of the conditions that can be certainly made worse by chronic inflammation, and they're tightly linked. Really, it's almost any health condition, inflammation is playing a role. And we see that a lot with metabolic conditions, like with obesity, diabetes, prediabetes, insulin resistance, heart disease, cholesterol, high blood pressure, different gastrointestinal conditions like GERD or heartburn, irritable bowel diseases like Crohn's and ulcerative colitis. We see it in asthma, allergies, eczema, sort of those allergic conditions, and are different types of arthritis, cancer, depression, Alzheimer's. So I'm going to pull a couple of these conditions and talk about them in a little more detail, just to kind of explain a little more. Heart disease is an important one to highlight because this is one where inflammation is really a key factor that makes almost like anything with the vascular system worse. It can contribute to creating unstable plaques. So over time, we all develop some kind of plaquing pretty much in our arteries. At some point, if we're lucky enough to live into old age, there's going to be something there. What you really don't want is there to be unstable plaque. And that is what can be flung from the edge of the side of your artery or blood vessel and get lodged somewhere we don't want it, causing the stroke or heart attack. So we definitely don't want inflammation involved with that. It's what makes having high cholesterol dangerous. And most frequently, the marker that we use to look at inflammation and heart disease is related to, it is called HSCRP, or high sensitivity C-reactive protein. It correlates highly with predicting future heart attacks and strokes when you get to the upper end, even if the inflammation is caused by a non-cardiac cause. So that's one that I will talk about more on future slides. So obesity and weight gain are closely related to inflammation as well. There's sort of a chicken or the egg thing going on with that, where being overweight can cause more inflammation, but it can also make it harder to lose weight. I'll tell you a little bit about how that works with these different hormones. Adiponectin is a hormone that inhibits inflammation, and it also inhibits plaque forming in the arteries, and it's higher in lower body weight individuals. So by losing weight, you're actually decreasing inflammation and decreasing plaque in the arteries via this hormone adiponectin. So that's kind of cool. Another hormone, leptin, it's often thought of as the hunger hormone, causing that sensation of hunger, and it's secreted by your fat cells. And when you have high levels of leptin circulating, you can have a heightened immune response overall, leading to heightened levels of inflammation. And if that is always being secreted, which it is to some extent with obesity, then you can often see high leptin levels and high levels of inflammation because of the leptin. Resistin is another hormone secreted by fat cells as well as immune cells, and that can promote something called endothelial dysfunction. So endothelial cells are the cells that line your blood vessels, and you really want them functioning well. Endothelial cell dysfunction is a big part of cardiovascular disease, and so if we can reduce any kind of harm to those cells through, we'll talk about ways we can do that later, but in part it would be getting resistin levels to be lower is our goal. Moving on, I wanted to talk about depression as well for a few minutes, because this one I think is fascinating with its connection with inflammation. There is more research all the time coming out about the connections with depression and higher levels of inflammation, especially treatment-resistant inflammation. So if people have not been, especially if people have not been responsive to medications or different treatments, then addressing inflammation is definitely an area that we need to, we should try to address. And yes, different types of infections like Bartonella, reading the comments, can impact endothelial dysfunction as well. And there's all kinds of different ways we can support that naturally in helping through like antioxidants and stuff that I'll talk about in the future. So with the depression, inflammation is actually thought to change neurotransmitters some and neurocircuits. And so I'll also talk about some things that have been studied in depression related to inflammation later too. All right, gastrointestinal conditions. I wanted to bring this up because, interestingly enough, 70% of your immune system or thereabouts is in your gut. And there's a good reason for that. This is our major interface with the outside world. It's more of an interface with the outside world than our skin, which is weird, but 2,700 square feet of area is formed with your small intestines because of all the microvilli that have all these little ridges. Overall, if you were to stretch it all out, it's 2,700 square feet. about the size of a tennis court. And so that's a lot of surface area that we are interacting with things, and our body is having to determine whether it's good or bad. Should it come in the body? Should it stay out? Do I need to fight this food or this bacteria? And so that's why our immune system is so localized in that area. I also wanted to bring up, there's been some studies on how intestinal permeability is associated with rheumatoid arthritis and how the gut can contribute to systemic inflammation. And the food we eat is really important for that reason. There are different ways to address intestinal permeability, and they even showed studies about identifying food sensitivities in rheumatoid arthritis and how healing intestinal permeability through that mechanism by taking out foods that we are sensitive to and allowing some gut healing to occur. Rheumatoid arthritis symptoms and inflammation levels significantly improve. There's also some connections with specific good bacteria or bad bacteria in our guts that contribute or lessen inflammation as well. So probiotics are getting a little bit more tailored to different conditions and can be used to really target things that we know are specifically wrong in certain conditions. Like the Clostridium leptum is associated with recurrence of Crohn's, and F. prosnitzii was shown to possess anti-inflammatory effects, for example. But there are many, many more studies on that. And I believe this is the last condition I'm going to highlight on here is dementia. The connections with inflammation here are also interesting. That same cardiovascular marker, hsCRP, has been suggested to be used as a predictor of dementia in the elderly, especially if you also have heart disease. And there's also been studies showing that there's failure to resolve inflammation in dementia with the microglia not clearing it as well. Microglia are cells in your brain and your nervous system. And people will also call dementia diabetes of the brain because of its other connections with the metabolic system and how it can respond well at times to some of the same treatments that are used for diabetes. Not all of them, that's nuanced and more than I want to get into right here, but fascinating area. Okay, so how do we know if somebody has inflammation? How do we gauge that? We'll talk about a few things here. First and foremost, there are some physical signs and symptoms of inflammation, and those can include the things I listed before at the beginning, like swelling, pain, redness, but you can also see signs of inflammation with visceral fat, which we can test for, and obesity is often associated with inflammation. That not always, but most of the time, if people lose weight, if they have weight to lose, their inflammation markers typically come down. And in many conditions, inflammation is not obvious and we can't see it necessarily, but we can, and you may not even feel it, but we can test for it in other ways. So lab testing, of course, hsCRP. So that's probably the most common way that we are going to test for inflammation in the office. A SED rate, or the ESR, is probably the second most common, but it's a little more specific to infections or some autoimmune conditions you can see a high SED rate in, but it's a little less frequently tested. And then autoimmune conditions, you might see signs of inflammation through tests like the ANA, rheumatoid factor, Hashimoto's antibodies, things like that. But not everybody needs those tested. Those would be if we think that somebody might have those conditions or conditions associated with those markers, we might be looking there for signs of inflammation. And then food sensitivity and allergy testing. If somebody is very reactive to many foods, then we can that's a sign that there may be more inflammation than we want, in a way that we might be able to address it. Um, we certainly don't do stool testing in everybody either, but there are some stool tests that can show that there's inflammation in the gut, including calprotectin. Calprotectin is mostly related to irritable bowel diseases like Crohn's and ulcerative colitis. You can also see IgA, which is an antibody that is made by your immune system in your mucosal surfaces, so like aligning your gut, and it can be associated with your body's response sometimes to an imbalance in bacteria, sometimes an infection. And some of the stool testing, we can look more at bacterial balance and what bacteria are present. And another lab test I wanted to put on here, because a lot of people don't know that you can test for it, is you can look at your omega-3 levels. Omega-3s are those anti-inflammatory fats that are high in foods like wild-caught fish and nuts and seeds. They need to be in balance with omega-6s, which are more pro-inflammatory. And so the standard American diet tends to be very high in omega-6s and low in omega-3s. And I found that even people that do try to make a point to eat a lot of nuts and seeds are often on the low end with their omega-3 index if they're not eating fish pretty regularly. And I think I'll talk about that more in the future too. Okay, so I've mentioned visceral fat a couple times. Visceral fat is the fat surrounding your organs, like your liver, and it is associated with an increased risk for different types of, especially metabolic conditions like diabetes, stroke, and even dementia. And the visceral fat itself actually produces different types of inflammatory cytokines. Some are listed there. And that inflammation doesn't stay there. It gets circulated through your body, through your vascular system. And so we'll talk about decreasing visceral fat as well. We can look at your visceral fat on the in-body body composition test. This will give you a reading of your visceral fat, and you'll get a number score. And we generally aim to get that under 10. Over 10 is just getting into that level that's just a little bit more concerning for your long-term health and avoiding some of those conditions. Okay, so now that I've said all this, what are we going to do about it? How do we actually reduce inflammation, reduce visceral fat? We'll talk about all of these: improving sleep and exercise, reducing stress, and improving fat hormone levels, not smoking. I don't have a separate slide for that, but don't smoke. And here we go. All right, so these are all evidence-based ways to reduce visceral fat. And we'll go into more detail with some of them, but exercise in general, both aerobic and strength training, can help reduce your visceral fat. Studies have shown in general that a lower carb or a ketogenic diet have shown that those will reduce visceral fat better than a low-fat diet. But a low-fat diet can also often reduce that if necessary, if people don't do well with a low-carb diet. And I will say too, there are better ways to do a ketogenic diet, and so many people have been doing these days. I see lots of people that have done it. They can be really successful with it, but you also need to be mindful still about the types of fats you're using, and there are safer, better ways to do that. So if you want to have a physician-guided keto, that is something that I do, and I like to really hone in on like making sure we're monitoring some things for people so that you're doing it at the healthiest way you can. Increasing soluble fiber can also reduce visceral fat. That can include things like flax seeds, sweet potatoes, and legumes. And intermittent fasting can, for many people, reducing sugar consumption. I think that's something most people can do, should do. Alcohol can contribute to visceral fat, so making sure we're keeping that low or no. And then reducing stress, um, and getting adequate sleep, 7 to 8 hours is what I typically recommend. Um, yeah, so sleep, want to talk about that a little more detail. Sleep in general, I think it's one of the foundations of health, and really making sure we're protecting our sleep and doing what we can to get adequate sleep is really important just for how we manage stress later in the day and how we function, our brain fog, all kinds of things. And inflammation levels are actually impacted by sleep as well. And sleep apnea is a big example of that, where sleep apnea can impact your metabolic risk for things like heart disease and stroke. Um, you don't have to look or be a certain way to have sleep apnea. I have patients of all shapes and sizes that have sleep apnea. Um, so if it's suspected, you can do a sleep study to have it diagnosed. Disrupted sleep is also a form of chronic stress. So I often do try to really improve that, reduce nighttime wakings, all that. There are a lot of ways to work on sleep. So if you struggle with sleep, I highly encourage you to see one of us. It goes beyond melatonin and it goes beyond sleeping pills, lots of different strategies there. All right, anti-inflammatory diet. So this can mean a lot of different things, and it can mean there might be different ways we want to do an anti-inflammatory diet with different people, especially if you do have food allergies and sensitivities. We would be wanting to take that into account with an anti-inflammatory diet. Certain things are bigger avoids for just about anybody, like sugar, trans fats, processed foods, which is a big category that's a little harder to pin down because there's no label that says it's processed, but basically try to shop the perimeter of the store. Classic, the better you can imagine it growing. Ahead of broccoli is, you can imagine that coming out of the ground, but a bag of Cheetos, where did that even come from? Also, refined grains, whole grains would be a better choice if you are doing grains, and avoiding vegetable oils. And then we want to target certain foods too, making sure you're getting good amounts of antioxidants. Berries and legumes have those. Omega-3s, like the wild caught fish, nuts, seeds, certain healthy oils like olive oil, avocado oil. And I really like to encourage people to include a lot of anti-inflammatory herbs and spices in their cooking, like turmeric, ginger, rosemary, and garlic. And exercise. So exercise will, in the short term, increase inflammation, and in the long term, it helps overall decrease inflammation. So before I get started, well, let me finish this slide. So what to do, research has shown that interval training and strength training are both great ways to decrease inflammation. You don't have to do these things, but I wanted to include something that was from research studies. So they did some on interval training, which is where you go 85 to 90% of your max heart rate, for example, for 20 seconds, and then go down for 2 minutes, do intervals, alternating in quick bursts of activity. And then strength training, 2 to 3 sessions a week of resistance exercise has been shown to reduce inflammation as well. So question about the types of nuts that are best, my top 3. I feel like my top 3 for health are not always people's favorites, but walnuts are great. Those are high in omega-3s. They're probably at the top of my list. Um, I think I'm always recommending Brazil nuts to people. You only need a couple, but they are the highest in selenium, which is a great nutrient for your lymphatic and vascular health, and it's an antioxidant as well. Um, but I also see a lot of patients that have lymphedema and lipedema where they can really benefit, but I think anybody can benefit from that. And the third, it's a tough one. Nut. So probably maybe almonds would be up there. It was definitely up there. And I'm actually ignoring seeds right now because I feel like that would be, there's so many seeds too that I like pumpkin seeds. I think hemp hearts are a great addition to the nut for the lymphatics is Brazil nuts. And really like the amount of selenium that I'm typically wanting people to have is you could get from just a couple Brazil nuts. Yeah. All right. So stress management is another big area that we want to do our best to deal with when it comes to inflammation. You may be familiar with cortisol, which is our stress hormone. And cortisol has a normal diurnal rhythm where it goes up during the day and it comes down just a little up in the afternoon, but then it comes down and gets low enough that before bed, if you have a good diurnal rhythm of cortisol, then it should be low while you're sleeping and then start to rise again early in the morning. Now, when you have chronic stress, then your cortisol levels might be doing different things. It might be chronically elevated, which is often associated with more weight gain in your central trunk area, your abdomen. And it because your cortisol is something related to stress, it is often it's there to kind of for a reason. It's there to prompt your immune system to defend itself. It's there to really get things going that need to happen in a stressful situation. But the thing is we're not getting attacked by bears or tigers or things as maybe we once were. But if you are chronically, worried about everything all day long and your cortisol is doing this, kind of elevated level the whole time, then it's not doing us any good. And so anyway, so that ways to reduce stress, it really matters what works for you. I generally encourage people to try to spend some time in nature. There are actually great studies on that and how I don't know if it's polyphenols or different, I forgot the word for it, but basically some of the molecules that are released from trees and other plants actually interact with our immune system and it's just fascinating. I wrote an article on it, I think on our website a while back, but Shinrin-yoku, or probably destroyed the proper pronunciation of that, but basically the Japanese art of forest bathing has shown how that can impact our immune system as well. So anyway, spending time in nature, getting a routine and planning, that works for a lot of people, just being in control of what you can be in control of. Protecting your sleep helps you be more resilient later. Mindfulness exercises like yoga and meditation, breathing exercises can be very helpful as well. Connecting with others. It's never my place to say somebody needs to change their job or relationship or anything like that, but sometimes that kind of stuff is needed. And then we, of course, have different types of other supportive supplements and things and medications or if needed. So stress management. Improving those fat hormone levels. I wanted to revisit this because um, the there are things you can actually do to change these things. So of course we want to, if needed, we would want to lose weight, and I know that's easier said than done. But a diet high in fiber and omega-3s and exercise and weight loss have all been shown to help raise adiponectin, and that therefore lowers inflammation and reduces the endothelial dysfunction. Lower leptin level to lower leptin levels, we want to improve triglyceride levels if they're elevated. So if you have high triglyceride levels, it could be impacting leptin levels as well. And there's some natural ways to do that. You can also do everything else to lower inflammation, helps lower leptin, sort of a circular issue there, but you got to work into that circle any way you can. Lowering resistin, which you can do with antioxidants, folate, olive oil. Those have all been shown to help lower resistin. Folate is high in like dark leafy greens, for example. And oral health. So everybody's dentists are, I'm sure, excited to hear me talk about oral health here. There are some studies that have shown that gingivitis, periodontitis are associated with vascular inflammation. And in periodontal disease, that can actually be linked to rheumatoid arthritis, especially when certain bacteria are present. There are some studies on brushing and flossing frequency, and they say no cause and effect can be established, but only because we need the study to be able to be designed and implemented in such ways where we could find that. But studies have shown that those who brushed less than twice a day or for less than 2 minutes had a threefold increased risk in heart disease compared to those who said they brushed more than 2 times a day or for at least 2 minutes, not but for at least 2 minutes. So brush your teeth twice a day for 2 minutes each time, and get regular cleanings once or twice a year or whatever your dentist recommends you do, and floss daily. And that can help reduce inflammation and cardiovascular health. All right, so we also have all kinds of different other therapies and things that can help reduce inflammation besides the lifestyle stuff, though some of these can be incorporated through nutrition as well. So I'll go through these: curcumin, boswellia, omega-3s, skirms, antioxidants. So curcumin is one of the most well-studied natural compounds out there, more than 21,000 studies on this. It is the major polyphenol found in turmeric, and it's most known for its anti-inflammatory and antioxidant activity. And it has been shown to decrease that hsCRP marker as well as other inflammatory markers as well. It works on a few different inflammatory pathways, same ones that some NSAIDs are working on to reduce inflammation. And there are, as I said, tons and tons of studies. It's been studied in conditions like ulcerative colitis, rheumatoid arthritis, osteoarthritis, cancer, diabetes, liver disease, depression, many, many more. One of our favorites. This is also one, I listed it off, but I do want to highlight, this is one of the ones that's been studied in depression, and it seems to have several different angles in which it helps with depression beyond the inflammation, but that's one of the avenues it seems to work on. Curcumin is notoriously hard to absorb, and so certain forms may be more beneficial, maybe especially for different conditions. But I don't want to discount the effect it has on the gut, given that's where most of our immune system is. It's still important that it gets in your gut for that interaction there. Boswellia. Boswellia works well with curcumin. A lot of different formulas will combine the two together. It is also very well studied and also known as frankincense. And it works on a number of different inflammatory pathways, and studies have shown, there was one study, I think this was a fairly small study, so I don't want to overplay it, but it's still interesting. It was shown to be more effective than sulfasalazine in controlling moderately active ulcerative colitis. And we do have many patients with irritable bowel disease that we use different anti-inflammatory herbs for that are in remission, that do very well. Also studies in rheumatoid arthritis and many other conditions. Okay, so I've touched on omega-3s a few times. A little more detail here. There are different types of omega-3s. ALA, EPA, and DHA are the main types of omega-3s, and DHA is one that is high. These are all really high in salmon, and these pictured foods behind it, even some eggs. Eating things that are pasture raised or wild caught are more likely to have higher levels of omega-3s than the grain-fed versions. And so we generally encourage that. And omega-3s have been shown to reduce cardiac events and disease and decrease progression of atherosclerosis, which is plaquing in your arteries. The American Heart Association recommends consuming about 1 gram a day for people without heart disease, which is about like 2 fish meals per week. And in people who have high triglycerides, getting 2 to 4 grams per day is recommended by the American Heart Association. You have to get omega-3s from diet. Your body doesn't make them. And there's some limited conversion into some forms of omega-3s. And that's where I think sometimes if you don't eat fish, you may have lower conversion from some of the other forms of omega-3s. But that's where I think testing can be really helpful, because we can actually look at these different types of omega-3s and see which one you need more of and how we can best tailor your diet for that. I also wanted to mention SPMs or resolvins. They're kind of the same thing. SPM stands for specialized pro-resolving mediators, and they are derived from omega-3s. They have studies in many different, let me back up. The SPMs, part of their job is to promote the resolution of inflammation. So when your body has this inflammatory response, it goes through this process of turning on inflammation and doing that cascade. And it also needs to go down and do a turn off of the inflammation. And we've got a SPM fan in the comments. So SPMs are great. There are studies in many different types of conditions, showing, like in osteoarthritis and rheumatoid arthritis, how they are lower, and different autoimmune conditions, they can be lower, and then we give them to try to help resolve inflammation in those cases, and we often get great results. So kind of a fun newer thing. We actually did a clinical trial years ago on SPMs at our office, and so I became a big fan of them then. Antioxidants. So you hear this word antioxidants all the time, and what's I think important to know about that word is that it's reducing oxidative damage. So oxidative stress is a process where these free radicals that can be caused by different things, we're all exposed to things that can cause oxidative stress. Smoking is a more extreme example, but basically, like living your everyday life, there needs to be a balance between the oxidative stress and damage that's occurring and the antioxidant activity. So that oxidative stress being something that contributes to inflammation, damage to DNA, injuring cell membranes, more oxidative stress and damage, you're going to have more problems with just aging and heart disease, metabolic issues. And I did list some of the other things that contribute to oxidative stress there: pollution, pesticides, processed foods, all that kind of stuff. So antioxidants then help reduce oxidative stress. And some examples are listed at the bottom there. Selenium, as I mentioned, with those Brazil nuts, vitamin C, vitamin E, polyphenols, flavonoids, NAC is a favorite of mine. So it's not even in just one category. Some of them are plant compounds, some of them are vitamins. Lots of different things can be antioxidants. And you can get them through food. This is one of the reasons why we often encourage people to eat the rainbow of fruits and vegetables, because you're getting different types of antioxidants through your food that way. For example, berries and apples are high in proanthocyanidins and quercetin. Tomatoes and red bell pepper higher in lycopene. Lutein and zeaxanthin are higher in spinach, broccoli, and bell peppers, et cetera, et cetera. So eating a wide variety, eating plenty of them. 5 servings is kind of a lot for some people, but I think it's a great goal to have. And in some cases, we supplement, if especially certain conditions might respond really well to certain antioxidants. All right, SCRMs. I wanted to talk about SCRMs because most people haven't heard of them, but it stands for selective kinase response modulators. There are two of the main types are rho isoalpha acids and tetrahydroisoalpha acids, RIAA and THIAA. They are derived from hops, and they've been shown to block the pathways involved in arthritis and other inflammatory conditions. So you might be able to get this. I mean, you will get some probably from if you drink hop tea, for example, but to get a really therapeutic dose of this, we typically do this in a supplement they have isolated these particular compounds from hops to get a good therapeutic dose. All right. And then, so something that is a little different is the red light therapy or photobiomodulation. This is really cool. So it uses far and near infrared light, and it has been shown to reduce inflammation, reduce oxidative stress is really the mechanism in which it does that, and can help promote lymphatic vessel regeneration and reduce pain. We use this for all kinds of different conditions because it can affect inflammation in such a broad way that it could affect many conditions. We certainly use it a lot for musculoskeletal stuff, but even like post-infectious inflammatory conditions, we found it to be helpful. And lymphatic support, we've used it for that. And this the one that we use in our office is called the Theralite 360. So it looks kind of like a tanning bed, but it's not. And what we love about it is that it has so much light hitting your entire body. It has 45,000 LEDs in the tube basically that you're in. And we optimize the light to a therapeutic dosage that works for different things. So we are, as you can see in the comments, if you want to try it, we are doing a free red light therapy session if you schedule a discovery consult or a new patient appointment. So there will be an opportunity to schedule a discovery consult afterwards, but you can also call after the event to do that. So yeah, I definitely think it's worth trying. I think it kind of feels a little bit like a massage afterwards, but you don't really feel anything. It's not hot. It's actually really pleasant. So Yeah, so red light therapy, it's very, very cool. Um, all right, so in summary, inflammation is it's a normal thing that our bodies need to do, necessary part of our physiology, but too much for too long can be harmful. And reducing inflammation can improve just about every health condition. And so we really find the lifestyle changes are foundational and absolutely fundamental to reducing inflammation through all those ways I mentioned. And the and so I would definitely you need to start there, but you want to kind of tailor any kind of treatment to really what's happening in your body. So looking at those labs, getting an like the evidence-based way to treat each condition through the most likely to succeed scenario. So anyway, that's it for me tonight. If anybody else has questions, I'm happy to stick on for a few more minutes. And if not, I'll just go ahead and close this for now. And I hope to see you all in the office. Thanks for coming out.